Welcome back. You know, infertility is something many women struggle with. They either don't know they have it or they suffer in silence. Dr. Stephen Hotze, founder and CEO of the Hotze Health and Wellness Center, Hotze Vitamins, you've been busy, my friend, and Hotze Pharmacy is here to tell us about his natural approach to dealing with infertility. And Dr. Hotze, okay, first of all, tell me about your holistic approach.
Well, we help our guests, and we call our patients guests. That's novel, isn't it?
I know, something new and different, right?
We don't have a number. We're literally a guest or a member. So we help them obtain and maintain health and wellness naturally. We know that it's important for four things to happen. You have to have a good eating program. We call it the Hotze Optimal Health and Eating Program. You have to have hormonal replenishment. As your hormones go down, you have to replenish them with the same hormones you made. You need to detoxify yourself with vitamins, minerals, and nutrients, and then you need to exercise. It's simple. This is not rocket science. And we don't use pharmaceutical drugs because we know they're toxins, and toxins poison you. And so many women come in. We see women who come in who have been to infertility clinics, and they call them infertility clinics because 75% come away infertile. That's why they're infertility. Only 25% of people that go to an infertility clinic will get fertile.
Well, how much does your hormone balance play into your fertility?
It's all about hormonal balance, and particularly about thyroid hormone. And Kathryn,
wait, your thyroid plays into your fertility?
Oh, yeah.
Really?
Absolutely. The most common cause of infertility, unbeknownst to all the infertility doctors, is low thyroid, because thyroid hormones govern your metabolism. And if your metabolism is low, you think you're going to be able to ovulate well and you're going to have normal cycles? No. Are your hormones going to be produced right? No.
You're also probably going to feel tired all the time and all this other host of other stuff.
And you don't think right, you can't sleep, and you got no romantic moods and inclinations, and you feel terrible because you have low thyroid, which goes undiagnosed because doctors only treat blood tests. They don't treat the patient.
What about progesterone?
Okay.
What does that do in a woman's body? Because you hear some women have high progesterone, low progesterone.
Well, most women don't have high progesterone. As women age, their progesterone goes down. Now, progesterone stands for promoting gestation or pregnancy. It promotes a pregnancy. So women...
So you got to have it in order to have a baby.
That's exactly right. It's the hormone of the second half of the month. In a 28-day cycle, you make estrogen all month long. In the middle of the cycle, when you ovulate, you make progesterone to ripen the womb, preparing for pregnancy. If you don't make enough progesterone, you're not going to get pregnant.
Huh, it's that simple. You make it sound so easy.
Well, and here's the other deal. With all the chemicals in the environment, those are hormone disruptors, and that's why we have all this problem with infertility. We're all drinking out of plastic, and we're taking all this food that's got chemicals in it and putting lotions on our body that has chemicals. It poisons our system. It disrupts our hormones. No wonder we're infertile.
Well, Dr. Hotze, let's move on over here to Kathryn Ritchie, who, okay, so you were in a very bad accident when you were about 18 years old, and you were told you were never going to be able to have kids. And how many doctors did you go to before you made it to Dr. Hotze?
I went to over 50.
Wow. And every single one of them's telling you you're not going to have... By the way, she has you have 4 kids now, right?
I do, yes.
So what was it that was so life-changing for you when you made your way to Dr. Hotze?
Well, when I first came to Dr. Hotze's office, as he said, I had been to over 50. I stopped counting at 50 because it was just becoming too depressing. And I had been having, well, I really had no period for a long time. I was starting to have ovarian cysts that were rupturing. I was tired all the time, but awake in the middle of the night. I just felt completely upside down in so many different ways. And so when I heard about the Hotze Health and Wellness Center, I thought, oh, it's just another doctor that's going to say I'm crazy or I need to take more estrogen. They just kept giving me estrogen, which was actually doing opposite of what I needed.
I was going to say, Dr. Hotze, can't that be really bad? Too much estrogen in a woman?
Well, the problem is, as I said, the problem is you want progesterone, which promotes gestation. But they don't get it. I don't know why they don't get it. I wrote a book.
You've written 2 books, by the way.
I've written 2 books, but I wrote a book about this, and why don't they read it? All the doctors, if you're out there and you're doing infertility and you can't get your girls pregnant, read my book, Hormones, Health, and Happiness.
There, we've got both of them right there. So
I'll give it to you, Doc. She'll help your patients.
So, Kathryn, how long did it take after you started visiting Dr. Hotze till you found out you were pregnant?
Almost exactly a year.
Wow, yeah, that's not long at all.
No. But right away, I felt different. I started gaining back weight. I had lost so much weight, and I wasn't having the ovarian cyst rupturing. I just felt like normal. I felt like a normal person again after so long.
So you were getting back in check, getting
Right.
back in balance.
Yeah.
Balance the hormones. It's all about hormonal balance and replenishment. So what had happened after her wreck, she was in a triple wreck. Her sister was killed. This happened in Moscow, Russia. She was hit by a drunk driver, and it killed her sister and almost killed her. And it took her all that time to recover. Well, that put a huge stress on her body, and that totally got her hormones out of whack. But all they wanted to give her was antidepressants, which antidepressants weren't her. Nobody's sick because they have low levels of antidepressants. She needed to have her hormones replenished and balanced, and that's all we did. It was
Well,
fairly
lo and
simple.
behold, now she has 4 kids.
4 kids later.
How old are the kids?
I think she's fertile.
Yeah.
So the oldest one is 5, and the youngest one is 5 months. So
Okay,
they're
she's been busy.
That's a great story, too.
Kathryn, Dr. Hotze, thank you so much
Jennifer.
for coming in. Now, for your free copy of Dr. Hotze's best-selling book, you want to visit his website, hotzehwc.com. You can also tune in to Dr. Hotze's radio show weekdays at 1 p.m. on 9:50 a.m. KPRC. Coming up after the break, what